I think the very first thing is to have a trusting and open relationship with patients about the challenges they're having with their medications. Many times patients don't want to report to their physicians that they're not adhering to the medication. They feel that there are expectations, they don't want to let the physician down, they're fearful of admitting this. So I think we all need to be very open to the understanding that sometimes it's difficult for patients to take medications, and patients need to feel that they can let their physicians know about that in a non-threatening environment. And once you can open that dialogue and have that kind of discussion, then we can start to get at the reasons why patients aren't taking the medication. And I think once we can then start to address either issues of education, of access, of side effects, then we can start to help patients really optimize their therapy. Number one, at the very time you start medication with patients, it's important to say, I recognize that it might be hard for you to remember to take this every day. I recognize that there might be times when it's difficult for you to take this medication, and let's have an open discussion about that. That's just from the very start. So that sets the groundwork for saying, it's okay. Recognize that you're going to do your best, but there might be situations where you're just not able to take the medication. So that's the first thing. The second thing is that in an interaction with a patient, I think one could say, oh, do you always take your medication? Well, most patients are going to say, of course I always take my medication. So I turn it around a little bit and say, how often do you miss your medication? By phrasing it that way, I think it gives patients permission to say, oh yeah, I do miss it, maybe once a week, maybe once a month, but it's already giving them permission to admit that, sometimes I don't remember to take this medication. And so I think, setting patients' expectations that we recognize this can be difficult and you're not going to be penalized, and we want to help you because we're all on the same team. I think that's really the key to this communication. I think this occurs in all kinds of fields, and certainly in the field of HIV, where taking medications is absolutely crucial to avoiding the resistance of the virus. A lot of work has been done to really try to facilitate patient-doctor communication about this issue and to develop strategies to help patients be able to stay on their medications. It certainly happens even with antihypertensives or cholesterol-lowering agents. So I think we need to recognize this is an issue. Let's just be honest about it, and let's work on strategies to help patients optimize the use of these medicines, because they can't work if you don't take them.